So, hello everyone, hope you're doing great. And my dear DNB PJ people are having their practical exam very soon. So, I just wanted to give them few tips to crack their practical exam. Hope this will be useful. And as I tell every time, suggestions are welcomed. If you have any more doubts, you can just put in the comments after the session. So, this is a disclaimer. So, the opinions expressed in these videos are of my own. I know you all know the pattern, but still revising this again for you. So, DNB practicals, and mainly I'm concerned with OG as of now. So, you know, it is of total 300 marks, and it consists of 20 OSCE stations of each OSCE 5 marks, and each OSCE is given 4 minutes duration. And you know, it is conducted nationwide at the same time. You will be displayed on the screen, and you have to attend all these questions, and it is conducted at the same time all over India. Next is clinical cases. So two clinical case examinations, each clinical case has 50 marks, so total it's 100 marks. And ward rounds, four ward rounds, each ward round is of 10 marks, so total it is 40 marks. And viva was, it is four stations. Each station consists of 15 marks, and the total is 60 marks. So the total practicals you are doing is for 300 marks. And the pass percentage is calculated for this total 300 marks. So coming to OSCE, this is going to be your savior, I'm telling you, because this is in your hand. And never skip any OSCE and maintain the time. So here I have given most of the questions will be asked from these things. Means some or the other how these topics will be included in your OSCEs. So never fear in writing OSCEs. Just open up your mind because you know everything. You have read theory so well. So you can easily crack OSCE. Never skip OSCE because it's going to be your savior in passing the practical exam. Make sure you revise your NST CTG because mostly picture along with or without a clinical scenario will be given. So observe the NST or CTG picture and answer the questions given. Histopathology slide pictures will be given many times, mostly oncology slides, and sometimes any other interesting or important histopathology picture will be given, and it can be combined with clinical scenarios or it can be given alone. And theory pertaining to management or the disease concern can be asked, or the pathology part of that slide can be asked. Imaging, mostly ultrasound images of obstetrics can be given, and sometimes even gynecology cases, and a few cases might be of his HSG pics. And a few questions on recent advances can be asked. And I forgot to mention here, two or three OSCEs related to biostatistics can be asked. So this is going to be a savior. Please don't skip any OSCE. Whatever you know, just write it. Because you know you don't have any negative markings. So try, you know everything. So try and write the answers well. Next, two clinical cases. So one case is going to be a obstetrics and one case is going to be a gynecology. And both should be presented like a long case. You have to take a proper history, examine and write within a stipulated time. So make sure you don't miss out anything in that time period. History presentation should be proper, and the way you present should be in flow. So know the basics first before you enter into any advanced things. Whosoever is coming to us externals are clinical persons and they are seeing patients on regular basis, so they can catch hold of you on important points. So never miss any important findings during your case presentation. Properly do the examination and be cool and just complete the case sheet and keep with you. Third, which is very interesting and easy scoring, is your ward rounds. Here, mostly post-operative cases will be given. It can vary, but I'm just telling the common scenarios. So mostly post-cesarean sections can be given to you, either emergency or elective, and sometimes even post-op gynae cases can be given. So the examiner will sit besides you and he or she will observe how you are approaching that case. So mostly you have to do an examination rather than asking history here. So the scoring will be according to the observations made by you, how you are examining the patients. Are you doing a proper head to head examination without missing any points? And the questions will be pertaining to the post op care starting from day 0 to 2 mostly. And immediate and late post-op complications, how do you manage that case, what are the medications given, how do you prefer giving a thromboprophylaxis, what is the criteria, and how do you manage post-op anemia. So these are the few questions which I wanted to share with you, but it is more of practical things, so don't miss this and don't miss any observation. Just revise in your mind how you take care of post-op patient in your daily routine, ward works or ward rounds. So just apply that. Never get panic during this ward rounds part. It is really really easy and highly scoring part. And finally you will enter these viva stations. So it is of four. First, I want to discuss you about the skull and pelvis. You should know about the basic anatomy first of skull and pelvis, but mostly the questions will be preferred on mechanism of labor of different topics. It can be either normal labor or of any other presentations like breech, occipital, posterior. It can be many externals favorites. So one at least once you should revise this before entering the practicals. And instruments, obviously you all are doing so well, so you will definitely remember basic ops and gynae procedure instruments. But here the important thing is laparoscopy and hysteroscopy instruments which you should revise. For these, as I tell you multiple times, you must know to identify the instrument first. Then only you will be proceeded with any question. If you're unable to identify the instrument, the examiner will really get irritated and she might just stop with that instrument only. So always know to identify an instrument first. Third station will be specimens, and specimens mostly you will identify definitely. It'll be of fibroid, ovarian mass, or some other cases related to oncology. But in specimens, you must be able to tell the theory part well, management, complications, symptoms, how about that disease, etc. So if you know theory part well, you will definitely crack this station. And fourth is the easiest one, drugs and contraception. Hope you all will do this station so well. So I don't want to give more information about this station. So what I want to tell you is practical exam time. Yes, it'll be anxious and you will be panicky sometimes, but make sure you are having good food, cool, having adequate hydration, adequate sleep before the exam, and then enter the practical exam hall. Because the presence of mind is very important rather than getting panic attacks. If you are focused and cool, you will get to know easily and you will be able to remember the topics which you have read earlier. So be cool and crack the exam because you know everything. So I want to wish you the confidence and focus you need to do your best in the upcoming practical exam. All the very best. And thank you so much. If you have any more questions, please put in the comments. I'm very happy to answer it. Thank you.